Hello and welcome to Medical World. I'm Dr. Savita, and I'm excited to guide you through the fascinating world of medicine. On this channel, we will explore a wide range of topics to help you understand and master medical concepts. Don't forget to subscribe, like, and share this video with your friends. In today's first lecture, we will dive into anatomy and its subdivisions. Stay tuned and let's begin this journey of learning together. What is anatomy? Anatomy is the branch of biology that studies the structure of living organisms, including their systems, organs, tissues, and cells. It involves understanding how different parts of the body are organized and how they function together to maintain life. In simple terms, anatomy is the study of how living things are built, like understanding the human body, its organs, and how everything works together. Subdivisions of anatomy. Anatomy is the scientific study of the structure of living organisms. It is divided into several branches for systematic and in-depth understanding. The main subdivisions are gross anatomy, macroscopic anatomy. Explained in detail. Gross anatomy, also called macroscopic anatomy, is the study of the structures of the body that are visible to the naked eye. This includes organs and tissues that can be seen without the aid of a microscope. Explanation in simple words. Gross anatomy is the study of big parts of our body like heart, lungs, bones, muscles etc., which we can see without using a microscope. In medical school, students first learn about the human body through gross anatomy. The dissection of a cadaver helps students understand gross anatomy better. Doctors use knowledge of gross anatomy to perform surgeries. Gross anatomy helps us understand how organs are placed and connected in the body. When you see a diagram of the human skeleton, you are looking at gross anatomy. Types of gross anatomy are surface anatomy, regional anatomy, systemic anatomy. Let's see surface anatomy. Surface anatomy is the study of the external features of the body and how they relate to deeper structures beneath the skin. In simple words, surface anatomy means looking at the outer parts of the body, like skin, bones that can be felt, or muscles that show, and understanding what lies underneath them. Explanation with examples. Doctors use surface anatomy to find the exact location of internal organs during physical examinations. Nurses use surface anatomy to locate veins when giving injections or drawing blood. Surface anatomy helps athletes and trainers understand muscle placement and posture. When you feel your ribs or collarbone, you are using surface anatomy to understand your body structure. Artists often study surface anatomy to draw human figures accurately. Regional anatomy. Definition. Regional anatomy is the study of all the anatomical structures, muscles, bones, nerves, blood vessels, etc., in a specific region of the body, studied together as a group. In simple words, regional anatomy means learning everything about one part of the body at a time, like studying the head, chest, or leg fully with all its parts. Explanation with examples. In regional anatomy, a student might study the chest area, learning about the lungs, heart, ribs, and blood vessels all at once. Regional anatomy is helpful during surgeries, as doctors need to know all the structures in a specific area. By studying regional anatomy, we understand how different organs and tissues work together in a particular region. In cadaver dissection, regional anatomy is often used to focus on one part of the body at a time. Understanding the neck region through regional anatomy helps in surgeries involving the throat or thyroid gland. Systemic anatomy. Definition. Systemic anatomy is the study of the body by individual systems, such as the skeletal system, muscular system, nervous system, etc. In simple words, systemic anatomy means studying one system of the body at a time, like learning all the bones in the body, skeletal system, or all the muscles, muscular system. Explanation with examples. Systemic anatomy helps students understand how each body system functions on its own. In systemic anatomy, all the organs and structures of one system are studied together, no matter where they are in the body. Doctors use systemic anatomy knowledge to treat problems related to a specific system, like the digestive or respiratory system. When we study the nervous system, including the brain, spinal cord, and nerves, that's systemic anatomy. Systemic anatomy is common in textbooks, which often have separate chapters for each body system. Microscopic anatomy, histology. Definition. Microscopic anatomy, also known as histology, is the study of structures in the body that are too small to be seen with the naked eye. It requires a microscope to observe tissues and cells. In simple words, microscopic anatomy is about looking at very tiny parts of the body, like cells and tissues, using a microscope. Explanation with examples. Microscopic anatomy helps scientists understand how tissues and organs function at the cellular level. Doctors use histology to study tissue samples and diagnose diseases like cancer. When we look at blood cells or skin cells under a microscope, we are studying microscopic anatomy. Histology slides are prepared in lab to study the detailed structure of tissues. Microscopic anatomy is important for understanding how body parts work inside, beyond what we can see with our eyes. Types of microscopic anatomy are cytology, histology, cytology. Definition. Cytology is the study of individual cells, their structure, functions, and life cycle. In simple words, cytology means studying one cell at a time, what it looks like, what it does, and how it lives. Examples. Cytology helps doctors detect cancer cells in body fluids like blood or urine. In cytology, scientists study cell parts like the nucleus, mitochondria, and cell membrane. Pap smear tests are an example of cytology used in medical diagnosis. Cytology is important in understanding how cells grow and divide. Microscopes are essential tools in cytology to see cell details clearly. Histology. Definition. Histology is the study of tissues, groups of similar cells, and how they work together to perform specific functions. In simple words, histology means studying how many similar cells come together to form tissues, like muscle tissue or skin tissue. Examples. Histology helps in diagnosing diseases by examining tissue samples under a microscope. There are 4 basic types of tissues in the human body: epithelial, connective, muscle, and nervous tissue. In histology labs, scientists prepare thin slices of tissues on slides for study. Histology explains how tissues work together in organs like the liver or lungs. Doctors rely on histology reports to understand the severity of a disease. Developmental anatomy. Definition. Developmental anatomy is the study of structural changes in the body throughout a person's life, from fertilization to adulthood. It especially focuses on the early stages of growth, such as the embryonic and fetal stages. In simple words, developmental anatomy means studying how a human body grows and changes from a tiny cell in the womb to a fully grown adult. Explanation with examples. Developmental anatomy helps us understand how a baby's body forms inside the mother's womb. Doctors study developmental anatomy to detect birth defects and abnormalities during pregnancy. Embryology is a part of developmental anatomy that focuses on the early stages after fertilization. Changes during puberty are also studied under developmental anatomy. Scientists use developmental anatomy to learn how organs develop and what can go wrong in their formation. Subdivision of developmental anatomy is embryology. Embryology is a branch of developmental anatomy that focuses on the formation and development of an embryo from fertilization until the 8th week of pregnancy. In simple words, embryology is the study of how a baby starts forming in the womb, from a single cell to a tiny human during the first few weeks. Explanation with examples. Embryology helps doctors understand how organs and body parts begin to form in a baby. During embryology studies, scientists observe how a fertilized egg turns into an embryo. Birth defects can often be traced to issues during embryonic development. Embryology provides the foundation for understanding human development in the early stages of life. Ultrasound scans during pregnancy help observe embryonic development in real time. Comparative anatomy. Definition. Comparative anatomy is the study of similarities and differences in the anatomical structures of different species of animals, including humans. In simple words, comparative anatomy means comparing the body parts of humans with animals to understand how they are alike or different. Explanation with examples. Comparative anatomy helps scientists understand how living beings evolved over time. By comparing the bones of humans and animals, we can see common patterns and shared ancestry. The forelimbs of humans, cats, whales, and bats look different but have the same basic structure. This is studied in comparative anatomy. Darwin used comparative anatomy as evidence for his theory of evolution. Veterinary doctors study comparative anatomy to treat animals by understanding similarities with human anatomy. Pathological anatomy, morbid anatomy. Definition: pathological anatomy, also known as morbid anatomy, is the study of changes in the structure of organs and tissues caused by disease. It focuses on how diseases affect the body's normal anatomy. In simple words, pathological anatomy is about studying how diseases change the structure of organs and tissues in the body. Explanation with examples. Pathological anatomy helps doctors understand the physical changes caused by diseases like cancer or tuberculosis. By examining tissue samples, pathological anatomy reveals how diseases have altered the structure of organs. Doctors use pathological anatomy to diagnose diseases and determine their severity by studying organs affected by the illness. Autopsies are performed to study pathological anatomy and understand the cause of death in many cases. Pathological anatomy is essential for finding new treatments and understanding how diseases progress in the body. Radiographic anatomy. Definition: radiographic anatomy is the study of internal body structures using various imaging techniques like X-rays, CT scans, MRIs, and ultrasounds. These techniques allow for the non-invasive visualization of the body's internal organs and tissues. In simple words, radiographic anatomy means using machines like X-rays, MRIs, and ultrasounds to see inside the body without cutting it open. Explanation with examples. Radiographic anatomy is crucial in medical diagnostics, as it helps doctors see inside the body without surgery. X-rays are commonly used in radiographic anatomy to view bones and detect fractures or tumors. CT scans give a detailed image of the body's organs and are often used for diagnosing complex conditions. MRI scans show detailed images of soft tissues, helping doctors understand problems in the brain, muscles, and organs. Ultrasound imaging is widely used in radiographic anatomy, especially in pregnancy, to view the fetus and check for abnormalities. Clinical anatomy. Definition: clinical anatomy is the application of anatomical knowledge to the practice of medicine, particularly for diagnosing and treating patients. It involves using an understanding of body structures to aid in clinical procedures and treatments. In simple words, clinical anatomy means using knowledge of body parts and their functions to diagnose and treat patients in a clinical setting, like a hospital or clinic. Explanation with examples. Clinical anatomy is essential for surgeons, as they need to know the exact locations of organs and tissues to perform safe surgeries. Doctors use clinical anatomy to understand symptoms and make accurate diagnoses based on the physical examination of the body. Clinical anatomy helps in understanding physical therapy techniques, where knowledge of muscle and bone structures aids in treatment. During medical examinations, clinical anatomy allows doctors to determine if the internal organs are functioning properly. Anatomical knowledge is applied in clinical anatomy to guide procedures like injections, catheter placement, and organ transplants. Functional anatomy. Definition: functional anatomy is the study of how the structures of the body function and work together to perform specific tasks. It emphasizes the relationship between body structures and their roles in bodily movements and physiological processes. In simple words, functional anatomy is about understanding how different body parts, like muscles, bones, and organs, work together to help the body do its jobs, like moving or breathing. Explanation with examples. Functional anatomy helps us understand how muscles and bones work together during movements like walking or lifting. Doctors use functional anatomy to study how organs like the heart and lungs cooperate for breathing and circulation. Athletes benefit from functional anatomy by learning how their body parts work together for better performance and injury prevention. In physical therapy, functional anatomy is used to design exercises that improve movement and strength in patients. Functional anatomy is essential for understanding how the body adapts to stress, exercise, or injury. Applied anatomy. Definition: applied anatomy is the practical use of anatomical knowledge in medical practice and clinical settings. It focuses on how anatomy can be directly applied in real-life situations such as surgery, physical therapy, or emergency care. In simple words, applied anatomy means using knowledge of body structures in real-world situations, like when doctors perform surgeries, treat injuries, or care for patients. Explanation with examples. Applied anatomy is critical in surgeries, as surgeons use their knowledge of anatomy to remove tumors or repair organs safely. In emergency care, applied anatomy helps doctors quickly assess injuries, like broken bones or internal bleeding. Physical therapists use applied anatomy to design rehabilitation exercises based on a patient's body structure and condition. In obstetrics, applied anatomy helps doctors understand the changes in a woman's body during pregnancy and childbirth. Applied anatomy is used in forensics to understand how certain injuries occur and assist in criminal investigations. Topographical anatomy. Definition. Topographical anatomy is the study of the body's internal structures in relation to the surface anatomy and their spatial relationships with each other. It focuses on the location of organs and tissues in different regions of the body. In simple words, topographical anatomy is about understanding where organs and structures are located in the body and how they are arranged relative to each other. Explanation with examples. Topographical anatomy is used by surgeons to locate and identify organs before performing operations. Doctors use topographical anatomy to find specific organs like the kidneys or liver in relation to nearby structures. In topographical anatomy, knowledge of the body's regions helps in diagnosing conditions affecting specific parts of the body, like the chest or abdomen. Emergency medical professionals rely on topographical anatomy to quickly locate injured organs or tissues in accident victims. Topographical anatomy is essential for understanding the exact position of organs when planning procedures such as biopsies or injections. Subscribe Medical World YouTube channel.